Women's aspirin is a combination of aspirin and an antacid, which helps reduce heartburn and upset stomach that aspirin may cause. Aspirin is used to reduce fever and relieve mild to moderate pain from conditions such as muscle aches, toothaches, common cold, and headaches. It may also be used to reduce pain and swelling in conditions such as arthritis. Aspirin works by blocking a certain natural substance in your body to reduce pain and swelling. Your doctor may direct you to take a low dose of aspirin to prevent blood clots, reducing the risk of stroke and heart attack. If you have recently had surgery on clogged arteries, your doctor may direct you to use aspirin in low doses as a blood thinner to prevent blood clots. When taking women's aspirin for self-treatment, be sure to follow all the directions on the product package. If you have any questions, it's important to ask your doctor or pharmacist for guidance. Remember to take this medication by mouth with a full glass of water, unless directed otherwise. Avoid lying down for at least 10 minutes after taking the medication to prevent stomach upset. If you experience stomach upset, you can take the medication with food or milk. It's important to be aware that the antacid in this product may interact with other medications, affecting their absorption by your body. Talk to your doctor or pharmacist about how to schedule your medications to prevent this problem. The dosage and length of treatment should be based on your medical condition and response to treatment. Read the product label for recommendations on the maximum number of tablets you can take in a 24-hour period, and how long you may self-treat before seeking medical advice. It's crucial not to take more medication or take it for longer than recommended unless directed by your doctor. Use the smallest effective dose and consult your doctor or pharmacist if you have any questions. If you are taking women's aspirin for self-treatment of headache, seek medical help right away if you also experience trouble speaking, weakness on one side of the body, or sudden vision changes. Consult a doctor or pharmacist if you have headaches caused by head injury, coughing, or bending, or if you have a headache with severe or persistent vomiting, fever, and stiff neck. Remember that pain medications work best if they are used as the first signs of pain occur. Waiting until the pain has worsened may result in the medication not working as effectively. It's important not to use this medication for self-treatment of pain for longer than 10 days, or to self-treat a fever that lasts longer than 3 days. In these cases, consult a doctor because you may have a more serious condition. Promptly inform your doctor if you develop ringing in the ears or difficulty hearing. If your condition lasts or gets worse, or if you think you may have a serious medical problem, be sure to tell your doctor promptly. If you experience upset stomach or heartburn, it's important to let your doctor or pharmacist know. Your doctor has determined that the benefits of using this medication outweigh the risks for side effects. Many people who use this medication do not experience serious side effects. However, it's important to tell your doctor right away if you experience severe nausea or vomiting, unusual bruising or bleeding, difficulty hearing, ringing in the ears, signs of kidney problems, unexplained tiredness, dizziness, dark urine, or yellowing of the eyes or skin. In rare cases, this drug may cause serious bleeding from the stomach, intestines, or other areas of the body. Seek medical help immediately if you experience severe or persistent stomach pain, black or tarry stools, vomit that looks like coffee grounds, trouble speaking, weakness on one side of the body, sudden vision changes, or a severe headache. While very rare, it's important to seek medical help if you experience symptoms of a serious allergic reaction, such as fever, swollen lymph nodes, rash, itching or swelling of the face, tongue, or throat, severe dizziness, or difficulty breathing. Remember, this is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you experience any other effects not mentioned here. Before taking women's aspirin, make sure to talk to your doctor or pharmacist about any allergies you may have to aspirin or other pain relievers. It's also important to discuss any health problems you may have, such as bleeding disorders, kidney or liver disease, stomach problems, asthma, gout, or if you are on any medications. If you drink alcohol or smoke, be aware that using women's aspirin may increase the risk of stomach bleeding, so it's best to limit alcohol consumption and stop smoking. Also, if you are planning to have surgery, let your doctor or dentist know that you are taking women's aspirin. Children and teenagers under 18 years old should not take aspirin if they have chickenpox, the flu, or any undiagnosed illness. Aspirin should also be avoided during pregnancy, especially from 20 weeks until delivery, unless specifically directed by a doctor. If you are breastfeeding, it's important to consult your doctor before using women's aspirin, especially in larger amounts. Low-dose aspirin for heart attack or stroke prevention may be used if directed by your doctor, but it's important to discuss it with your healthcare provider. It's important to be aware of potential drug interactions when taking women's aspirin. Some products that may interact with women's aspirin include acetazolamide, blood thinners such as warfarin and heparin, corticosteroids like prednisone, and herbal medications such as ginkgo biloba. Before using women's aspirin, consult your doctor if you have recently received certain live vaccines. Also, check all prescription and non-prescription medicine labels carefully, as many medications contain pain relievers or fever reducers known as NSAIDs. It's important to prevent an overdose of aspirin, so be sure to read the labels carefully before taking other pain relievers or cold products to make sure they do not contain aspirin. Daily use of NSAIDs like ibuprofen may decrease women's aspirin's ability to prevent heart attack or stroke. If you are taking low-dose aspirin for prevention of heart attack or stroke, consult your doctor or pharmacist for more details and to discuss other possible treatments for your pain or fever. Additionally, women's aspirin may interfere with certain lab tests, so be sure to inform lab personnel and all your doctors that you use this drug. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the U.S., you can call the local poison control center at 1-800-222-1222. In Canada, residents can contact a provincial poison control center. Symptoms of an overdose may include burning pain in the throat or stomach, confusion, changes in mood, weakness, ringing in the ears, fever, rapid breathing, changes in urine output, seizures, or loss of consciousness. If you take women's aspirin regularly or in high doses, your doctor may want to monitor your liver and kidney function, blood count, and salicylate level. It's important to keep all your medical and lab appointments and consult your doctor for more details. There are various women's aspirin products available, some with special coatings and others are long-acting. It's best to ask your doctor or pharmacist to recommend the most suitable product for you. If your doctor has advised you to take women's aspirin on a regular schedule and you happen to miss a dose, take it as soon as you remember. If it's close to your next scheduled dose, then just skip the missed dose and take the next one at the regular time. Don't take a double dose to make up for the missed one. Remember, always follow your doctor's instructions. When it comes to storing women's aspirin, it's important to keep it at room temperature and away from moisture and light. Avoid storing it in the bathroom and be sure not to use any women's aspirin product that has a strong vinegar-like smell. It's essential to keep all medications out of reach of children and pets. When it comes to disposal, do not flush women's aspirin down the toilet or pour it into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. If you have any questions about how to dispose of women's aspirin, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.